Yeah, hi everyone. I think it's after a long time that I'm taking a video for you. Because of the request from you guys, okay. Coming to the pharmacology, pharmacology is one of the toughest part, as everyone thinks. Even I agree for this. Pharmacology is one of the toughest one, and it is completely memory based. So not only pharmacology, there are many subjects which are completely memorized. In fact, complete 240 marks examination of Neet is going to be completely memorable. It's not logical way what we think in or physics or chemistry or mathematics, where you can sit and come out with a formula and you can come out with an answer. It's not like that. It's not concept oriented, and very few questions are concept or smart way of answering. Like, apart from the 40 odd questions where you need to go for the elimination based method, rest all questions, or in fact every question is a memory based question. So from the past 10 days we are going with lots of basic stuffs, and every day we are having few sorts of good revisions, good classes, and it's all like making the stuff very simplified, means subjecting them to easy to eat, like easy to understand the things. So it's all like whatever the basic things, you have to be perfect with the synopsis. First of all, you need to have a proper synopsis where you need to organize each and everything, and then you need to read them, then you need to solve problem MCQs, then you need to go through the synopsis again, interrelate with each other. So this is how you need to go with the basics, right? So apart from the decent result what we have made in the recent NEET examination with 44 GDCs, out of which 17 GDCs are from Andhra and Telangana, and rest from all India and state councilings. So that's a great achievement, because last year we have only 21 GDCs, and the team with the students, with the last year students, we made a move, like at least by next year we need to enter and we need to make 30 GDCs. So it's a very good result that 30 is our target, but we made 44. It's very decent enough. So we keep a target for this year, that is 60 GDCs. Conquers, we need to make 60 GDCs this year at any cost, and the team is ready for you guys to work day and night, and these 6 months you need to make it very hard. You need to work hard in hell, and we need to end up with at least 60 GDCs. That's the target. Okay, so going into the today's class, that is the anti-HIV drugs or antiretroviral drugs, or a part of viral therapy. So I just want to give this brief introduction, that is how this HIV is going to affect the individual, and how the process and the drugs, or the classification of the category of these antiretroviral drugs, where does they act and everything. So once the HIV is there, this is the HIV cell, and this is the commonly infected CD4 or the helper cells. This is the CD4 or helper cells. Like with this code protein, that is GP41, the HIV cell is going to enter the CD4, and the CD4, they will have a receptors. These are the receptors, that is CCR5 and CXCR4. These are the receptors which are associated. Out of these, this 5 receptor is the main receptor. It is the main one which is responsible. Okay, so once it enters, it's the viral RNA is going to convert it into viral DNA by a simple enzyme, well-known enzyme, that is reverse transcriptase enzyme. And once the viral DNA is going to be integrated with human DNA, this is called as an integrase, is the enzyme that is used, and finally an RNA is formed. A combination of DNA and viral DNA, the RNA, the DNA is formed, which is again going to convert it into RNA. The RNA is going to give you the proteins which are initially inactivated, and this process is called as a translation, and the proteases are going to act to active these proteins. That is, the inactive protein is going to be converted into active protein, and this active protein will goes out, and again it's going to infect the new CD4 cells. So at each step there is a particular drug acting and inhibiting this process. One here, one here, one here, and one here, right? So this is the basic stuff, or the basic logical, whatever like you feel like it. If it is a concept thing, just relate it to your concepts. So, and next, moving to the basic classification. Okay, in this basic classification, it's very easy coded classification, where you need to remember there are many widths in this classification actually, but you need to remember the 3. For now we'll remember just 2, that is 1 here and 1 here. Means you need to remember these 2 drugs for now. Okay, so please try to practice once or twice. We'll go further into the classification. So first is nucleoside reverse transcriptase inhibitors. Okay, what are they? Nucleose reverse transcriptase inhibitors. You can remember, you can solve once the classification is done. For now, you remember because it is nucleoside, right? All are not nucleoside. There is one exception, that is a nucleotide. This is nucleotide, where you can remember it is very easy one. T T T. Okay, it is very easy. Okay, all of these are nucleoside except one that is related to T, that is nucleotide. Simple, done. We are done with the first category. So we are going to the second category. Second category you can remember with the word den. D E N, done. So second category is with the word den, and third category is protease inhibitors, and you can remember with the word NAVIR. All proteases will have NAVIR. 1, 2, 3, 4, 5, 6, 7. And after this class, I feel like the most easiest question is identify which of the following is a protease inhibitor. Right? Simple, because you will have NAVIR in it and you can identify easily without knowing anything. So the next categories are these three categories I was talking about. You have to remember two VIRs, right? One in the first category and third VIR is this. Okay, these are most commonly asked questions. Okay, entry inhibitor, you can break this entry inhibitor. Okay, EN means envelope. The envelope is nothing but what we have discussed, because HIV has a protein which helps in entering into the CD4 count with this the receptors that are available on the CD4, that is GP41, that is the envelope, and inhibits the fusion. FU is called as a fusion, and it's going to play with the T cell. So you can remember this. This is the one of the most commonly asked question. And coming to the last category, because I have previously told that CCR is the main one, right? Main receptor that is responsible, and you can remember this M. Done. You're done with that. And integrase inhibitor, if you go like you will have TRE. That is the integrase inhibitor, right? So this is a simple way of going with the classification of anti-HIV. So I have seen many questions related to these particular drugs. There are 3 or 4 drugs. Most of the questions are related to this. This is the most commonly used drug in the case of HIV, and whenever there is a needle stick injury for the patient as well as for the doctor, the immediate prophylaxis should be done with this drug. Or whenever there is a chances of vertical transmission of HIV from the mother to fetus, you can advise this drug. But the major side effect of this drug is bone marrow suppression, and this drug is contraindicated whenever the patient is having less HB, anemic patient, because there is a bone marrow suppression. So that is a key question. I have seen this key question in the recent Neet examination. So one more add-on point is like rifampicin is going to increase the clearance rate of this particular drug, and with this drug there are few adverse effects like lipodystrophic syndrome, nail hyperpigmentation, and lipotropy. So there is a few side effects. Coming to the next most commonly asked question, the most commonly asked question is a dose limiting pancreatitis. Okay, so the bioavailability, please just go through the rest of the points. So this is one of the most commonly asked question, and there is an indirect question related to this question in the recent Neet examination. So this is the third category. This is also related to the dose limiting, but it is related to the peripheral neuropathy, and it causes lactic acidosis because it's going to affect the mitochondrial toxicity. So indirectly it's going to cause or decrease the pH and increase the H+ ion levels, and it also results in the pancreatitis. But the most important point is like lipodystrophy is among all the antiviral drugs, this is the one which is having the best lipodystrophic syndrome. Okay, yeah, done for now. So I feel like this video is useful to come out with new mnemonics and codes and make this classification very simple and easy. Guys, this classification is very important because I have seen many questions related to this classification in these recent examinations. Okay, so recent examinations, they're very concerned about this classification because HIV is very related to the dentist, right? It is related to the dentist, so it is must you have to go through this classification. Okay, and definitely we are going to come out with few more videos very soon. Please try to follow the group, give your best, and please try to work, please try to spend as much as time as possible with the group in this span of 6 months. You have left over with 6 months and your target is to be done. Okay, so thank you, all the best, and take care.